incontinence after childbirth to be suspended.
Says the mesh procedure has caused her painful side effects. Now a senior gynaecologist at Addenbrooke's Hospital has said tens of thousands of women across the world have suffered because some surgeons failed to ask enough questions about the safety of some brands of mesh. Clever Glasson reports.
Kath Sampson feels vindicated, not just for herself, but for the thousands of women who have suffered as a result of mesh tape surgery. For 15 months, she's fought for these implants used to cure stress incontinence to be banned. But then she found this video online, and Addenbrooke's gynaecologist saying that some medical companies didn't carry out enough research.
We really should have been saying to these companies, take your tape and go away because you have no evidence, but we didn't, okay? And we may now lose an outstanding operation because we failed to police the situation.
Speaking at a conference, Dr. Mark Slack said some mesh had caused internal injuries in tens of thousands of women around the world.
It was a tragedy which was created by greed.
Kath from March in Cambridgeshire, one of the women who suffered complications from her surgery known as TVT. She's now had her mesh removed.
I'm stopped in the street, I'm stopped in the supermarket, in the swimming pool changing rooms, by women who've said, I've seen your story. Do you mind if I talk to you about what's happened? Lost relationships, they've lost their jobs, some of them can't hardly sleep at night because the pain keeps them awake. Hearing of their suffering in an operation that was supposed to improve their quality of life, but in fact has completely destroyed it, is heartbreaking.
Some hospitals in Scotland have suspended the use of the surgical mesh operation, and 3 American states are suing one of the companies which manufactures mesh. Dr. Slack said Addenbrooke's does still offer TVT surgery. His belief that the right tape, used properly, is still the best treatment in some cases.
It is a good operation with low complication rates, done by the right people for the right indications. A complete ban, which it may well happen, would be, at the moment, with the literature that we have in our understanding, be a great shape. Because it would mean that a lot of patients who are currently having a minimal access operation would actually then have to go back to having a much bigger operation, which would carry its own set of complications.
Kath accepts that many women have had no problems after TVT surgery, but like many who have suffered life-changing complications, she still believes the operation should be banned and intends to fight on. Clever Glasson, ITV News, March in Cambridgeshire.